The Palm Beach Civic Association expands its communication outreach with a state-of-the-art television studio. We call it Studio 33480, the zip code for the beautiful island of Palm Beach. Sponsored by Finley Galleries, our goal is to bring you in-depth interviews with the most colorful and knowledgeable personalities on the island. And now, our host.
Welcome to Studio 33480. I'm Wendy Rutledge. This time, we're going to turn the interviewing over to Healthcare Committee member Warren Belmar, who's going to introduce us to an organization whose aim is to reduce the cost of prescription drugs.
Welcome to Palm Beach TV. This morning, we're going to be visiting with Dan Liljenquist at Civica, a not-for-profit organization that has been in existence now for a few years. As many in our audience are unfamiliar as to why you championed the formation of Civica some years ago, would you please explain the decision to develop a nonprofit solution to address supply and pricing problems in the generic drug industry as they are faced by our local hospitals?
Thank you, Warren, and great to be with you. I'm excited to tell this group about Civica RX. Civica was formed about 4 years ago. It's September of 2018. And the mission of Civica is really simple: to ensure that essential medicines are available and affordable to everyone. And this idea came about really in the start of 2016 when I was reading and writing a column for my local newspaper in Salt Lake City, Utah. And I heard for the first time about a gentleman named Martin Shkreli. You may remember Martin Shkreli, Warren, who a gentleman who cornered the market on a particular drug called Daraprim and raised the price from $13.50 a pill to $750 a pill. And this is a life-saving medication. And he basically said, this is how free markets work. And then just 6 months later, Heather Bresch of Milan, who the maker of the EpiPen, they raised their prices by 6,500% over a period of years, to where a 2-pack of EpiPen was $600. And she basically said, "True, this is how markets work." And as a free market guy, I looked at this and said, wait a second, epinephrine's been on the market for over 100 years. Daraprim was developed in the 50s. It is well past its patented life. How are people who didn't make the drugs, didn't create them, able to corner a market and then raise the price on society and really put families and patients in desperate situations? And I was wrestling with that. And as I thought about it, there were really 3 factors that were causing these problems in the market. The first was inelastic demand for a particular drug. If you need Daraprim or epinephrine, if your child eats a peanut and they're allergic to peanuts, you need epinephrine or your baby dies. And so there's really no close substitute for some of these drugs. The second is it costs a lot of money and a lot of time to set up production to make generic drugs, years and millions of dollars, but each dose you make costs pennies. And so there's a lot of, you've got to reach economies of scale in manufacturing to be able to lower the total price and spread your investment over volume. But the other factor was that in some of these markets, really only 1 or 2 manufacturers are needed. So you're not going to have 5 competitors in a market where you only need 1 production line. And what that's allowed over time is certain groups to monopolize certain drugs and then raise the price exorbitantly on society at large. And so I was wrestling with this issue. I thought, it's unlikely that Congress is actually going to do anything about this. So the idea of creating a nonprofit drug company that would organize the demand side of the equation, working with hospitals and health insurance companies to form and create what we call a healthcare utility, new model that we could maybe enter this market, bring new competition in, and then reduce the prices of these drugs. And so that was the idea. And we launched Civica in 2018. Fast forward to today, we have over 1,500 hospitals involved in the project, 55 health systems, and now 140 million people covered by 23 large health insurance companies who are involved. And Civica now makes over 60 drugs. We've treated over 30 million patients and have made over 80 million doses of medication. So we're excited. It appears to be working. We've been able to lower the prices of these drugs and as importantly, make them more affordable and accessible to the market.
Well, having done that, what prompted Civica to start thinking about expanding its mission, and in particular into the production of insulin?
Back in August of 2016, I was on a treadmill at my local gym thinking about this issue. And when this idea came, we could fix these problems with a nonprofit drug company. One of the first drugs I thought about was insulin. My dad is an endocrinologist. He's a diabetes specialist, as is my brother and my brother-in-law. They practice diabetes medicine. What's happened over the last 20 years is even though these insulins that are the top of the line insulins today are 20 years past their patented life, the price of insulin has gone up by double digits every year for the last 20 years. And you would think once a drug comes off patent that the price would come down, and it's gone the opposite direction. And that's because there are 2 or 3 manufacturers that are involved in the space, and there are a handful of pharmacy benefit companies involved in the space. Insulin has always been on my list. I'm really grateful that we're now taking that on. We've about 2/3 of the money required to do this, and we plan to bring insulin to the market in 2024.
How do you know that it's going to remain as a not-for-profit organization?
We formed the company as a Delaware non-stock nonprofit corporation. We brought 9 large health systems, including the Mayo Clinic, Intermountain Healthcare, where I serve as the chief strategy officer, HCA, 9 other large health systems to form the company. But we also brought 3 major U.S. philanthropies to sit on the board. What we did then was wrote into the bylaws that it would take a unanimous vote of all of our governing board, including the 3 philanthropies, to ever convert Civica to anything but a non-stock nonprofit corporation. And so that's keeping us honest, and it's doing exactly what we wanted to do.
The main attraction, Dan, seems to be that your price will be a fraction of the current price. What price are you targeting for? How will it go to everybody, not just people covered by insurance or Medicare or Medicaid? And what challenges do you think you'll find in the distribution chain?
Look, our mission is to make sure these medicines are available and affordable to everyone. And the sad part about that march up in prices of insulin over the last decade, the people who are uninsured or underinsured pay the highest price. So the list price has gone up consistently by double digits every year for 20 years. Insurance companies typically have negotiated a discount and rebates to get some of that back, but the person paying cash out of pocket pays the highest price. And 1/4 of people with type 1 diabetes today are rationing their insulin because they can't afford it. Our effort is to bring a single, rational, transparent price to the market. So our target price for a vial of insulin will be no more than $30. And for a 5-pack of 3 milliliter flex pens, no more than $55. Now, let me give you a quick example of what that means for a patient. I have a friend, her name is Catherine Stewart. She lives in Utah. She's 16 years old and has had type 1 diabetes since she was 9. She uses 6 flex pens a month of Humalog and a vial and a half of Lantus, which is a long-acting insulin, each month. She pays $2,000 a month until she hits her family's $8,000 deductible, which is 4 months. She usually takes them 4 months. And then it's $500 a month for the rest of the year. She's paying $12,000 a year for insulin, and she is well insured. Civica's pricing she will pay $66 a month going forward for her flex pens and about $40 a month for her vial and half of Lantus. So her prices will go down from $12,000 to $1,200 a year. And that's for somebody who's insured. So take somebody who's not insured. Our goal is to make those same prices available to anybody, regardless of whether you're insured or you pay cash. So we expect to materially lower the price and the burden of this disease on people with diabetes. Now, how will we distribute? We will work with any company to distribute Civica insulin, as long as they obey by our rules. And that is, we plan to print on our packaging a maximum suggested retailer price. So we can signal to the market when you're getting ripped off. Because right now, when you go buy a medication, you have no idea what it should cost. And what we're building in that is a fair markup for retail pharmacies to make a margin, but we are signaling to our customers, the people with diabetes, what a fair price is. And we expect this to be broadly carried.
When you describe the savings that the individual consumer is going to achieve, whether it be through lower reimbursements through insurance or people without insurance, we haven't addressed the other side of the coin. What kind of savings can Medicare, Medicaid, and insurance companies that are reimbursing at $12,000 a year expect to find if they're only asked for reimbursement of $1,000 or so? What kind of savings across the economy could occur if you're able to succeed in what you're proposing?
We expect the cost savings to be enormous. I mean, there's billions and billions of dollars of additional costs that's being pressed on society at large to prop up essentially the cartels that have arisen around insulin. And what we hope to do is democratize insulin, put it within reach of regular people, and make sure that price on society is coming down at large. Now, you're correct. There's a lot of burden of those prices that get pushed to uninsured and underinsured people, but it's also large health plans, Medicare, Medicaid, and insurance companies. Now, that's one of the reasons why we're so optimistic about this, is that when we showed the price of what we could manufacture insulin to the insurance companies involved with Civica, it was a no-brainer. They could see they would have immediate significant savings to their organizations and to the employers and the individuals who pay their premiums. So they were excited and enthusiastic to participate, because once you take all that noise out of the middle, all of those kickbacks and rebates and all the money that gets spread around, and just do a transparent cost plus model, there's a lot of value that can be returned back to patients and to the insurers that cover them.
The New England Journal of Medicine article of June 9th that I mentioned described you as a model for not just insulin, but for other philanthropic ventures and other medicines. What do you see in the future if you're successful in terms of others following your example and Mr. Kubin's example?
What I've really enjoyed about setting up this business, and when we first announced it, I met with the Wall Street Journal, and the team there is like, we've never seen a company quite like Civica. It's not quite a philanthropy, but it's not a for-profit business either. It's a new animal. And what we believe it to be is venture philanthropy, in the sense that we're trying to impact the overall market for the benefits of society overall. And I think we can use market-based approaches to solve some of our problems with new ownership structures or lack of ownership, like we have done with Civica, that actually are more promising to me and could have a broader, larger, deeper impact on positive impact on society than maybe you could get by looking to the government.
Thank you for your time. It's a pleasure talking to you.
Likewise. Thank you, Warren.
Thank you, Warren, for such an informative interview and for enlightening us about Civica. And we'll see you next time right here in Studio 33480.
Studio 33480 is brought to you by the Palm Beach Civic Association, our sponsor, Finley Galleries, and our viewers. We welcome your thoughts on how our programming can best serve our members and residents.